We had a bit of a technical problem. I apologize for that. I had to change the laptop. Hope everything is fine. Thank you so much for joining me. Today's topic is about fat in diet, in our body, how we deal with it, cooking oil, is it good, is it bad, cholesterol, triglyceride, dangers, what we are being told, medications, and so on, everything about fat in a kind of summarized way. I hope this information will make you feel better about life and yourself, because a lot of things that we were told is not necessarily true. For decades, for example, they have been telling us that fat is the enemy, is not good, you have to stay away from it. But the fact is that our brain, our most important hormones, the brain of every cell in our body, which is called the membranes of the cells, and the body of the cover of the nerve cells, all are mostly made of fat to a large extent. Without fat, life would be impossible to carry on. If I removed all the fat from your body, you don't basically become thinner, you die, as easy as that. So, for example, every thought that comes to our mind, every heartbeat, every action that happens in our body, it would be impossible to take place without presence of fat. So fat is really important. But what makes it a bit difficult is how to eat it, when eat it, what quality to eat it, and how much of it, in what context. So fat is not just simply a source for the calorie. It is a structural material for our body, which I'll explain a little bit in details a little further on. As in addition, it is an energy source. Every gram of fat produces 9 kilocalories of energy in us, whereas carbs and protein is only 4 calories. This is 9 calories per grams. This is a hormone regulator substance, so it participates in the structure of the antennas receiving the hormone, as well as a lot of steroid hormones. It's a signaling molecule. Like when the immune system is alert, it has to send signal around to inform the rest of the body that there's something going on. It is done by fat molecules. It's a protector of organs, like kidneys and everything is covered in a layer of fat. So when there's a physical trauma to the body, the delicate organs remains healthy inside. It's a heat isolator or insulator. It doesn't allow the heat to get off our body quickly and fast. Basically, is an essential element for a healthy life. So as you see, fat is not the enemy. Just poor quality of fat and in most of the time metabolic dysfunction in people are becoming the problems. So why fat is essential? Because about 60% of the dried weight of our brain is fat. As I said earlier, every cell is covered with a membrane, with a layer that protects cell from outside environment. It is made of phospholipids, which is fat with phosphorus. Cholesterol is really important to create integrity within the cell, so it makes everything stand fixed on its place. There are some essential fats like DHA, for example, also known as some of the fish oil, which are really, really important for our structural integrity and even cognitive function. We cannot think without having the right fat in our body. We cannot learn without them either. And imagine the nerve cells, which look like electrical wires, have to be isolated with some substance so that there's no short circuit when they pass by each other. This cover comes from myelin sheath, which is about 70 to 80% made of fat. Now imagine electrical wires without insulators, without coverage, without the cover. So it won't be possible to have any electrical system working in that sense. This is what the nerves do in our body. Basically, every cell needs fat, and we have about 50 trillion of these cells in our body. These phospholipids of the membrane is the conscious part of the cell. It's flexible, it can move, it can accommodate things, it can create things in it, it can understand what is good to come in, what is bad to stay outside. It's a conscious part of the cell, and as I said earlier, is made of fat. Even the organelles inside the cell, like mitochondria, Golgi apparatus, things like that, these are instruments inside the cells which are really important in keeping the cell alive. They have cover around them, all of them again are made of fat. Without fat, we cannot, cells cannot enter nutrients into themselves. They cannot get rid of the waste quickly. Cells cannot communicate between each other. And receptors will not function anymore. So they remain deaf and blind to each other without fat. Fat is also required for synthesis of many essential biochemical compounds in our body, which are very important for a normal life to happen. For example, all the female and male hormones are made of fat. All the adrenal hormones are made of fat. Some of them are responsible to control salt in our body, which is main mineral to keep the water inside us, inside the cell, outside of the cell. Vitamin D is purely made of fat, is made of cholesterol when we are we are exposed to sunlight. The UV of the sunlight will turn cholesterol into vitamin D, which is essential for the health of bones, for functioning muscles, for immune system, and brain cells to work as well, you name it. Without fat, which is in this case cholesterol, it is not possible to create bile salts. Bile salts are the secretion of the bile from the liver, that when we eat fat in our food, they turn the fat into an emulsified way or form. Now it can be absorbed going through the body, so we cannot digest fat without having fat inside. These bile salts are synthesized in liver. For example, women with low fat percentage in their body, they frequently lose their menses. They cannot keep the period regular. So fat is equal to survival. When it comes to immunity, not only all the surface of the cells in the immune system is made of fat, but also inflammatory signals. And when there is infection, and how the immune system controls the infection and sends the message around is all done by fatty substances in our body. So the little fat actually weakens the immune system. That's why in traditional folk medicine, when somebody has severe diseases, we give them soup, which is already boiled, liquidy, fluidy, and easy to digest. And usually there is a piece of bone marrow, at least traditionally from this part of the land, the earth. This is what people do. They use a small piece of bone marrow, because that fatty substance in the bone marrow will help the person to recover much, much, much faster from his cold and flu. Now, if we talk about the types of fat, we have saturated or unsaturated. Saturated fats are always being on the red flag, that this is not good, this is dangerous for the body, and so on. The saturated fats are usually found in meat, eggs, dairy, coconut, palm oil, and so on. They are incredibly important for a balanced health in our body. They are not only a source of energy, but also they participate in construction of the cell structures. They produce hormones in our body. They help our body to absorb vitamins. They protect the organs, as I explained earlier, and they keep the body insulated from the temperature outside, so we don't lose our heat quickly and fast, because that means sudden death. This belief that the saturated fat was the cause of early heart diseases goes back to an idea of diet heart hypothesis back in the 1950s. Today, the evidence strongly proves that otherwise. The current research suggests that the health effects of the saturated fat depends on the overall dietary pattern. What is the quality of our diet? The food source, the quality of the food ingredients that come from, and what saturated fat replaces in the diet. For example, if we consume saturated fat from a balanced diet, from an animal grazing naturally on a mountain or something, there's incredible amount of every form of fat in their body, and it helps us to get rid of the refined carbs, because if refined carbs are consumed with bad fat, this becomes the source of cardiovascular diseases and everything else that we've been told in the past. And also replacing more of unsaturated fat with saturated fat is another help for the support of the cardiovascular system in our body, for a healthy healthier heart. Now, we have unsaturated fats which have a double bond between the carbon atoms in them. They're looking for hydrogen. Anything that absorbs hydrogen, it gives electrons. So it becomes a source of power. It becomes a source of life and longevity. These unsaturated fats are divided into two groups. We call them, some of them, monounsaturated fat, like for example, olive oil, avocado, a lot of nuts, and polyunsaturated fat, as also known as omega-3, omega-6. I'm sure you've heard about these things before. These fats support heart, brain, eyes, immune system, not only functionally, but also structurally as well. And they regulate inflammation in our body. Some of these fats are called essential fatty acids because the body cannot produce them. They have to be imported through the food. They are the omega-3, also known as ALA, and omega-6, which is LA. They have to be present in the food. So it's important for us to eat a healthier and more balanced quality of food when it comes to the fat, like everything else too. Now, omega-3 by itself eventually turns into two other compounds called EPA and DHA. They are specific forms of omega-3 or fish oil, or they are found, let's say, in flaxseed or things like that. They are incredibly important for the health of brain, heart, and they act as anti-inflammatory balancing agents. So they control inflammation in our body. So we have omega-6, we have omega-3, but there's a lot of idea about omega-6, what is omega-6, and how, because there is a flag on omega-6, many people think that omega-6 are only causing inflammation. That is not true. Omega-6 and omega-3 have to be in a form of balance, and omega-3 fatty acids are anti-inflammatory. They support heart and brain, whereas omega-6 is a little bit more pro-inflammatory, because this is very important for growth and development, because the immune system has to be alert. When an intruder comes into our body, somebody has to give the signal for the rest of the soldiers of the immune system to be alert. This partially is a work of some of the omega-6, like arachidonic acid, for example. So, but not all the omega-6s are pro-inflammatory, only some of them, a small percentage of them. And they become dangerous when there is no balance between the consumption of omega-6 and omega-3. I'll explain this a little bit later. So all goes back again and again to a better balanced diet. Okay, problem happens in terms of omega-6 consumption when it is consumed in very large amount, in an unproportional amount in comparison to the omega-3. So when there is very little omega-3 and tons of omega-6, especially when people are used to consuming highly processed or very refined carbohydrate, this is the flag. This is something that will create a predisposition to chronic inflammation, and after some time it becomes a chronic disease. Now, let's talk about cholesterol, the cholesterol stuff that makes a lot of people so scared. Did you know that cholesterol is actually essential for our health to continue? Yes, you heard me right. It is needed for, against cell membrane, steroid hormones, like all the female and male hormones and adrenal hormones, things like that. Vitamin D is purely made of cholesterol, as I said earlier, bile salts, and brain function. About 20% of the cholesterol in the food is absorbed. About 80% of it is produced inside our body, mostly by the liver and to a lesser extent by the brain, because the cholesterol produced by the liver cannot pass through the barrier supporting the brain, because nothing can pass through that barrier going to the brain. Brain is like the center of the command with high alert security around it. Not everything can pass, including cholesterol. So brain has to produce its own cholesterol. You know, cholesterol is something that makes the cells stable. The cells have a very fluidy membrane around them, as I said earlier, called the phospholipids, that holds all the receptors and channels and every other structures on the surface of the cell membrane. But Without cholesterol, everything will collapse on each other. So cholesterol comes in to create integrity for the structure of the cells. Different cholesterols include LDL, HDL, VLDL. These are actually not cholesterol. These are vehicles transporting cholesterol from point A to point B. Cholesterol is produced in the liver, and upon the request of the cells, it sends to every cell in need. There's a vehicle used for that called LDA, low density lipoprotein. These are protein molecules carrying cholesterol and a esterified form of cholesterol, which is kind of easier to transport within the bloodstream. So they take cholesterol from liver to the tissue. This is LDL. HDL is the opposite one, is the delivering cholesterol as opposed to LDL, which is the recycling cholesterol. The delivering cholesterol, HDL, will bring all the cholesterol spread in the body back to the liver. So when people have problem with the rise of LDL, which is flagged as bad cholesterol, which is not a good idea to call it a bad cholesterol, is a liver problem. There's something about the liver of the person which is excessively producing the LDL, because large amount of LDL, especially when it is oxidized, let's say because of stress, due to oxidative stress, become a problem, a threat to the cardiovascular system. The factors that also make, other factors that also make LDL a bit more dangerous includes inflammation, blood pressure, diabetes, smoking, alcohol, lots of acidification to the body, like consumption of a lot of refined carbs, sugar, lots of coffee, things like that. You know, when the body is balanced, everything will remain in balance. Now, let's talk about very, very ugly form of fat, which is available in the market as food, and it's called trans fatty acids. Because unlike fat from animal source, which contain cholesterol and it could become solid in room temperature, most of the plant-based fat, remain liquid in room temperature. Okay, so in order to create butter type product from a liquid oil, they have to change the molecular configuration. So from a cis configuration, they create a trans configuration. Now the vegetable oil becomes solid, and for example, they call it margarine. Okay, it looks like butter, it smells like butter, but it's not butter. The fact is that when we consume trans fatty acids, our liver cannot break them down into soluble stuff so that it could be digested. They remain undigested inside our body. So this becomes a problem. So this is not a real fat at all, and it's very important for you, if you hear this, to stay away from all these kind of unnecessary traumas to the body in terms of consumption of wrong food. These trans fatty acids will this time increase the LDL. They decrease the HDL, which is supposed to be opposite way. They increase inflammation and of course increase the risk of cardiovascular diseases in future. The scientific consensus in this area is very, very strong. Now, choosing healthy fat. You see, it should be mostly from whole kind of food sources. Like for example, extra virgin olive oil, avocados, nuts, seeds, if they're not GMO, oily fish, but they shouldn't be farmed. Remember earlier I said even saturated fats are not dangerous unless they come from an imbalanced source of food. This is like farmed animal. This is like genetic modification. This is when food goes through a lot of processing technique. It changes its shape. It changes its vibration. Eggs are a good source of whole food fat, but the problem is that most of the egg today are not even real. Think about the chicken that they used to run around, eat a lot of stuff, free to go everywhere and lay eggs. Now they keep the chicken in a small cage and they're stimulating them to lay more and more eggs. And you see, the taste is not even the same. Anyways, from natural dairy, now imagine cattle like cow goat or sheep which has been grazing naturally on the body of a mountain. They eat so many different shrubs of small little herbs. So there is every form of essential fatty acid you can imagine in their meat, in their milk, in the dairy products, and so on. This is different than the milk coming from a factory, which its animal is being fed with only soy or corn, which are most of the time genetically modified, and bone powder is added to their food because they will lack minerals. They end up with mineral deficiency, and because they are cows, cattle, sheep, and their stomach is not supposed to digest bone that has been added. Now they put them on antibiotic, otherwise they swell up and die. It cannot be compared to the normal dairy. So think about the natural food. Now you understand when I said even saturated fat is very healthy when it comes from the natural source. This is what I mean. And of course, to avoid a lot of processed meat, because the fat in them is very, very ugly and very dangerous for the health as well. We need to encourage ourselves to minimize or avoid completely hydrogenated or even partially hydrogenated oils. Repeated deep frying food, when people fry over and over with the same oil, which is under a lot of tremendous amount of heat. We should avoid heavily processed snacks, because combination of these refined carbs with the let's say saturated fat, especially if it comes from ugly sources, this becomes the source of the disease and problem. And also avoiding ultra processed food rich in refined fats and refined sugar. And the take home message is that, of course, fat is essential for life. Every cell depends on the fat. Brain is largely made of fat, and also cells too. Cholesterol are necessary for hormones and vitamin manufacturing and the cellular structure. Quality matters more than simply eating less fat, avoiding trans fat and ultra processed food. Aim for balanced intake of omega-3 and omega-6, and so on. As a strong conclusion at the end, I would like to mention that for more than half a century, we have been taught that we should fear fat. But today, we know that the human body and a good quality health actually depends on them. The goal is not a low-fat diet. It's choosing the right fats, right amounts from a real food. Now, let's talk about cooking oil. Today, due to advanced industry and a large demand, of course, factories are producing a lot of food, but many of them are not even natural. Some of them are the commercial cooking oils that you see outside. They're mostly seed oil, also known as vegetable oil. They're not necessarily dangerous by themselves, but the way that they are extracted, it's under a lot of heat, pressure, and tons of chemical that causes a lot of oxidation. This will make the oil already rancid, because oil is delicate, and if the molecules of the oil break down, they could create undigestible compounds which will get stuck when we consume them as food. They include, for example, canola, sunflower, corn oil, soybean oil, safflower oil, cottonseed, and so on. Some other ones are including hemp seed oil, sesame oil, flaxseed oil. Their oil is extracted under pressure and lots of heat, and using a lot of chemicals as solvents to extract the oil out. This is what breaks the oil apart and makes them dangerous. Seeds oil are high in polyunsaturated fatty acids. That includes omega-6 and omega-3, but most of the time the amount of the omega-6 is much, much higher in comparison, in proportion as well. So when we use this kind of cooking oil and we heat them repeatedly, and our diet has less of omega-3 and more of refined carb, this becomes a situation that predisposes the body to a lot of other chronic diseases, from obesity to real diseases in future. So it is very important for us to be aware of what we are eating. Traditionally, we used to eat animal fat, like let's say butter, ghee, as oil, as cooking oil. Um, they were healthier, especially at that time. Animals were grazing naturally, and the environment was natural. So that brings us to the end of our short conversation today. I hope I shared with you some of the ideas how to protect yourself, how to protect your life, how to prevent diseases in future when it comes to consumption of oil. So next time when somebody says your cholesterol is high, don't panic. It's not a big deal. You need to do something to rectify your liver function and look for a behavior that puts your liver under a lot of pressure. That doesn't mean only food that you eat. Liver has also emotion in it. Anything that makes us angry all the time, it puts pressure on the liver. It puts pressure on the cardiovascular system. So think about the ideas that cannot be digested in addition to what am I eating that is causing these problems. Don't panic, take it easy. You don't have to go over medication immediately, although you can take it at any time if you want to, because these medications have a lot of side effects. But there are natural remedies that work really, really well in reducing high cholesterol in people and is effective in most of the people. A combination of those natural remedies with a correction in your diet is almost guaranteeing getting rid of any sort of high lipid in the blood, including cholesterol and so on. Let me know if you have any questions. I will be more than happy to take time and look at them and answer them. I want to create an interactive program in future so that when I become a better expert in how to handle these videos, uploading these videos on YouTube, and then we can bring you up and share your information and ask your question, answer your questions, and just be more kind of mutually interactive in this kind of videos so that the result will be better. This is the end of our video, and thank you so much for your time and spending time here with us. Let me know what you think. I hope to see you very, very soon.